Good afternoon, everyone. I'm Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. Welcome to our Wednesday press briefing. I'm here with Commissioner Ken Lawrence. Today is Wednesday, September the 2nd. We are in week 26 of the pandemic here in Montgomery County and our 10th week in the green phase. Since the September 1st press release, we have 43 new cases of COVID-19 reported in Montgomery County, which brings us to a total of 10,933. These positive cases are a result of a positive test for the virus, not from the antibody test. 3 of these cases are from long-term care facilities, and 37 of these tests are, and the remainder are from the community. 37 of these tests are from the last 7 days, so we're seeing a real improvement in our turnaround times. 3 of these tests are from 8 to 14 days ago, and 3 are from more than 1 month ago. And that represents labs that have not been promptly reporting their results to the Pennsylvania Department of Health system. So we do occasionally see these tests that are really lagging. Today's positive individuals are from 27 municipalities. All 62 Montgomery County municipalities are home to individuals with COVID-19. Today's individuals range in age from 3 months old to 95 years old. And as always, you can see our county map found at www.macopa.org/COVID-19 for updated municipal information. Today we have 24 females and 19 males. I am pleased to confirm that no additional Montgomery County residents have lost their life to COVID-19, which leaves us at 827 deaths confirmed positive from COVID-19. In terms of our hospital beds, we're holding steady at what has been kind of a new normal for the last 7 weeks. And that's about between 45 and 50 hospitalized patients. Today we're at 47, with 8 individuals requiring a ventilator, or approximately 17%. So this is always just a sobering reminder that people do continue to be hospitalized from this disease, and a very significant number continue to require a ventilator to help them breathe. In terms of the Montgomery County Correctional Facility, the situation is stable today with no new cases to report. The facility will undergo the 3rd round of testing for the coronavirus beginning tomorrow. Any inmate or staff member who has previously tested negative will be retested. We will share the results of this 3rd round of testing with you next week. In terms of our community testing, pleased to announce that testing continues to go smoothly in our 3rd week with Mako Medical. Results are consistently available within the contractually promised 36 hours. Our testing capacity is currently at 50 tests per site per day at most of our sites. So this provides approximately 300 tests per day across the county sites. I do want to make note that we are on the eve of Labor Day weekend, and that in addition to our routine closing on Saturday and Sunday, all the county sites will be closed for Labor Day. If you do need to be tested over the weekend, I would remind you that both CVS and Rite Aid stores do offer testing 7 days a week. As a reminder, the county now has 6 COVID testing sites, and they are open Mondays through Fridays. None of these sites require a car to be tested, but we do ask that you make an appointment. All appointments are made the day of testing, and you can start making appointments at 8:30 in the morning of the day that you would like to be tested. You cannot book ahead. We do require that the person being tested is either a resident of Montgomery County or that you work in Montgomery County. These sites are at no cost to the individual, though we will bill insurance if you have it. You do not need an order from a healthcare provider, and we will test individuals of any age who need or want to be tested. As a reminder, there's a site in Pottstown, Lansdale, Willow Grove, Green Lane, Ardmore, and Norristown. And to learn about the hours and locations of each of these sites, you can go online at www.mocopa.org/COVID-19 and click on the County Testing Information button, which is a big green button at the top of the page. And you can see all the sites, their locations, and then that is also where you go at 8:30 in the morning to make an online appointment. If you would prefer to make an appointment by phone registration is available for all of the sites. That also starts at 8:30 in the morning on the day that you'd like to be tested. And that phone number is 610-970-2937. And we do have Spanish-speaking operators as well as language line available through that phone number. Working together, we continue to suppress viral spread here in Montgomery County. As we head into the Labor Day weekend, please take extra precautions to stay safe. As you've seen from our data, we continue to have 40 to 45 new cases every single day, which means there are still plenty of virus circulating in our communities. As schools begin to bring students back, keeping the virus suppressed is more important than ever. While many of our 22 school districts are beginning the school year with a virtual format, all are hoping that they will feel comfortable bringing at least some students back in person later this fall or in January. The likelihood of their being able to do this depends on all of us working together to wear a mask anytime we are outside of our homes and around others, maintaining social distancing, following good hand hygiene, getting tested when we need to, and cooperating with contact tracing if you test positive. With school starting this week, I want to give teachers a very special and heartfelt shout out. Your world has changed dramatically. Not only are you working harder to be a teacher, but you are now being asked to be a public health rules enforcer and an IT specialist with hybrid and remote learning. You are among the unsung heroes in our community, and you are rising to the occasion and doing more than you ever imagined when you became a teacher. So thank you so much for all that you're doing. And I again call on our entire community to take every step that you can to help keep our entire community safe, and especially our teachers and our students. So let's see how we are doing today with our regular graphs. We will start with our date of test graph. And just as a reminder, this graph shows with the gray bars in the background the number of total daily positives based on that particular day of testing. And then the red and the pink lines, which have merged pretty much, are our total 7-day average and total 14-day average. And why don't we do the zoom in on the closer up of the last 30 days here, a little bit easier to read. So the red and the pink lines are the 7 and 14-day average from all of our cases here in the county. The dark blue is the 7-day average from our community cases, and the lighter blue is the 14-day average from the community. The orange is the long-term care facility 7-day average. And right on top of it is the long-term care facility 14-day average. And you can see that those numbers are now extremely low. We've been sort of, oscillating around this normal, kind of new normal now of, 35 to 50 cases a day. And that's reflected in our numbers. But the good news is that our 14-day average is a little bit lower than it was a week ago, but our 7-day average is just a touch higher. So we seem to be in pretty much of a steady state at this point. But I think that all of us would like to see those daily case numbers get a little bit lower than they are now. This week we brought back our age cohort chart. And just as a reminder, this is the share of Montgomery County COVID-19 cases by the census age brackets. So you can see the age brackets on the far left. The next column over is the percent of our Montgomery County population represented by the people in that age bracket. And then the next column is the percent of total cases that people in this age bracket represented on May the 1st. And then the total number of cases on July the 29th, and then how that changed. And then the total number of cases on August 12th, how that has changed, and then the total number of cases on September the 2nd. So as you can see, we have a bunch of red arrows for several weeks now in our younger cohorts. And this is very consistent with what we've been hearing about both in the Commonwealth and nationally. People from sort of that 30 years and younger being increasingly impacted by this disease. Certainly, I'm sure we have some returning college students that are reflected in these numbers. So this just continues to serve as a reminder that nobody is immune from this disease. And while younger individuals do not appear to be getting hospitalized as often as older individuals do, younger individuals can certainly transmit the disease to parents, grandparents, or others who might be at risk of a much more serious case of COVID-19. So we need to take these numbers very seriously and continue to remind everyone how important it is to wear that mask and stay socially distant, particularly if you are attending any type of social gathering where it's quite easy to get close to people without even really being conscious that you're doing it. So then we'll move on to our weekly positivity graph. And just as a reminder, the orange line shows the total number of people who live in Montgomery County that received a PCR test on the date indicated. And I continue to be very pleased that that number slowly and steadily is going up. I think the more people we test, the more that we know what's going on here in the county. Today, our positivity is at 3.04%. Actually, technically, that is through August the 28th. There's always a little bit of a lag on our positivity data because it takes a few days to get enough test results back in for the results to be meaningful. So just to repeat, as of August the 28th, our positivity is now 3.04%. That's down ever so slightly from the data last week when we were at 3.07. So we're basically just hanging steady. I would like to share with you that as of today, September the 2nd, we have tested, and when I say we, I don't just mean the county. If we look at all Montgomery County residents, 22% of them have been tested for COVID-19 at this point. So let me just restate that. As of today, September the 2nd, 22% of the 830,000 people that live in Montgomery County have been tested at some point since back in actually the middle of February, have been tested for COVID-19. So 22% is a good number. I'd be happy if it were a little bit higher. but it's great to see that so many people have been able to take advantage of the many opportunities that we have provided for individuals in our county to be tested. The more that we know about what's going on in our community, the better that we can respond and continue to suppress the spread of this virus. So that brings me to contact tracing, just my weekly reminder of how important it is to cooperate with contact tracing. On the good news front, 97% of the people that we connect with are fully cooperating with contact tracing, and we are so grateful for that. However, we continue to have trouble reaching about 30 to 40% of the people that we need to reach. So it's great that we're connecting with 60 to 70%, but we would really like that number to be 100%. If you get a voicemail from a contact tracer, please, please, please call them back. Our contact tracers provide a lot of support to the people that they speak with. Earlier today, my team shared a story with me about a mom whose child had tested positive for the coronavirus. She's a very concerned parent and has been closely watching her child, and she told the contact tracer that she's very anxious about her child's condition. The contact tracer was able to provide guidance and reassurance. And by the end of the conversation, the mom stated that she now feels that she knows much more about the virus, and the guidance has helped her greatly. She asked a lot of questions, and the tracer was able to provide her with all of the answers. And you could tell that she felt better by the end of the conversation. And that's really a point I want to emphasize. A lot of times when people find out they're positive, they tell our staff, oh, don't worry, we'll tell the people that we were around. And it's helpful if they do that. At least those people know that they've been exposed. But it's unlikely that that person is going to be able to answer all of their questions and give them the type of guidance that they need, that's fact-based, that's up to date, and will give them the maximum amount of information that they need to keep themselves and their family safe. And we'll also be able to offer them any support that they need, housing, food, anything else that they need to isolate or quarantine safely. So just remember that our contact tracers are here to help you, and please do cooperate if you get a call. So I have a couple of announcements today. First, as you may know, the Pennsylvania moratorium on evictions expired this past Monday, August the 31st. Tomorrow, the county commissioners will be voting on providing the Your Way Home Emergency Rent and Utility Coalition with a $6 million rent and utility relief package. Up to $9,000 of payments will be available to households that are at or below 100% of the area median income, are experiencing hardship because of COVID-19, and have overdue rent payments or utility bills. If approved, beginning September the 8th, the county's Your Way Home program will be working with several of our partner organizations in the community. They are Pottstown Cluster of Religious Communities, Aclamo, Manna on Main Street, and CADCOM to identify eligible households. Beginning on September the 8th, households can contact any of these partner agencies or call 211 to learn more about the program. Keeping families in their homes, particularly students attending school virtually, is critical to the health and safety of Montgomery County households and will help provide the necessary stability for families to get back on their feet as we work to recover from the impacts of COVID-19. I also today have a couple of community thank yous. So the first one is to Pastor Coleman at the First Baptist Church of Crestmont. As I'm sure you're aware, nationally and here in Pennsylvania, COVID-19 disproportionately impacts Black residents. In Pennsylvania, African American residents make up 11% of the population, but account for nearly 1/3 of COVID cases and 1/4 of the deaths where the race of the victim is known, according to the PA Health Department. This is an average of twice the rate of all other races and is based on a number of complex factors, including the lack of access to testing. So today we want to give a special thanks to one of our community partners and a strong advocate for health equity in our community, Pastor Jerome Coleman of the First Baptist Church of Crestmont in Willow Grove. Pastor Coleman took action to reduce these disparities by inviting the county to relocate our Willow Grove testing location to the church parking lot, a much better location for parking and general accessibility. Pastor Coleman then went the extra mile by having his own test performed live on Facebook to show residents how easy the process is. If you want to see that, you can go to the church's Facebook page and the video is there. So far, the county has tested 315 residents at the church since we relocated to this site on August the 24th. We truly appreciate Pastor Coleman's efforts and the efforts of all of our community partners to bring awareness and testing sites to underserved residents. Next, a big shout out to our Make Masks for Montco Facebook page. They are still up and running strong. They have over 2,600 members. Sewists on the site have made and donated approximately 25,000 masks to people in need in our community. And today I got the following story from my team that this site continues to support our community in multiple ways. Just today, one of our caseworkers from our Office of Children and Youth reached out asking if we knew of anyone who has a gently used sewing machine to donate to a 15-year-old youth who is interested in learning how to sew. Our donations coordinator in the Department of Health and Human Services posted in the Make Masks for Montco, PA Facebook group asking if anyone had a sewing machine they might be willing to donate. It only took 2 hours for the original post, which by the way went up today, for someone to donate a machine to this child. Thank you to one of the group's founding members, Colleen Peterson, who was able to make the connection with fellow group member Kelly Sakota. This is a testament to the genuine human nature of helping in this group and all of the good that has come out of it for our community during this pandemic. And finally, September is National Preparedness Month. So usually we talk about being prepared for disasters like floods, fires, and hurricanes. But if 2020 has taught us anything, it's that we truly have to be ready for everything. So now's a good time to take a look back at the last 6 months and evaluate what resources you had on hand when the pandemic started, what resources you needed, and come up with a plan for how you and your family might be better prepared for the next disaster. There are a number of helpful tips under the Emergency Management section of our Montgomery County Department of Public Safety's website. And you can find them at DPS, that's for Department of Public Safety, dps.montcopa.org. And here's a couple of the most important tips that you'll find. First, review your insurance policies to make sure you have adequate coverage. This is especially true for flood insurance, which is a separate policy from any homeowners or renters insurance. Second, build a network of family, friends, and neighbors. Talk about working together to help each other out with things like offering a place to stay in case you have to leave your own home. Third, put together an emergency kit. Make a list of all of the stuff that you and your family would need to survive on your own for several days, and then put those items together in one location so they're easy to get to when you need them. And finally, talk to your kids about preparing for emergencies and what to do in case you're separated. Reassure them by providing information about how they can help the family be prepared. And with that, I'm going to turn over to Commissioner Lawrence.
Okay. Thank you. I have two updates today, announcements. The first is I wanted to provide an update on round 3 of the Monco Strong Small Business Grant Program. And in this round of funding, we had $10 million, which was available from the Federal CARES Act. And just to remind people, we were pleased to award $6 million in the first 2 rounds to 480 small businesses in the county. Round 3 grant awards were once again administered by the Redevelopment Authority of Montgomery County in partnership with the Montgomery County Department of Commerce. Businesses that received funding in round 1 or round 2 were not eligible for grants in round 3. So here's a summary of the applications we received for round 3. We had 1,924 applications from 60 municipalities in Montgomery County. 59% of the applicants indicated they had applied in at least one of the first 2 rounds. 51% of the applicants indicated they are a minority-owned or women-owned business. 4% of the applicants indicated they are a veteran-owned business. And 81% of the applicants reported revenue of less than $1 million annually. After reviewing the applications, the RDA has awarded 960 grants totaling $9,993,000. The summary for round 3 grantees is as follows. 516 of the awardees identified as a minority and or women-owned business, representing 54% of the awardees, and 45 of the awardees identified as a veteran-owned business, representing almost 5% of the awardees. Grant awardees have been contacted via email by the Redevelopment Authority of Montgomery County with grant contracting instructions, and a complete list of all the awardees is posted on www.moncopA.org/MoncoStrongSBGP. And as always, we'd like to extend our thanks and appreciation to the Redevelopment Authority of Montgomery County's Board of Directors for their continued support, partnership, and collaboration on this program with our Department of Commerce. Yesterday, the Valley Forge Tourism and Convention Board kicked off its 6th annual Valley Forge Freedom from Hunger Food Drive, a campaign that builds awareness around hunger in Montgomery County. Due to COVID-19, this year's drive will take place solely online with a goal of collecting 15,000 pounds of food throughout the month of September. Monetary contributions to purchase canned goods and other foods will be accepted instead of physical donations. The Tourism Board is once again partnering with the Monco Anti-Hunger Network, known as MON, a coalition of hunger relief organizations working together to keep families stable with food assistance. MON provides resources to food pantries that feed more than 15,000 households a year and serve more than 80,000 people who are food insecure in our county. Participation at many of these locations is much higher than normal due to the COVID-19 outbreak, according to MAN officials. And we've talked about this during the course of this pandemic. So far this year, 73% of the 34 MAN member food pantries have seen an increase in volume, in some cases double or even triple, especially when non-essential businesses were shut down. At that time, the increase at high-volume pantries in Norristown and Lansdale saw as much as a 200 to 300% increase in client numbers. That's just one of the many reasons why this year's Freedom from Hunger Food Drive is so important. The Freedom from Hunger Food Drive benefits all people accessing food pantry services, which COVID-19 has caused that number to grow. We're still in a public health pandemic, and people more than ever will be relying on the Charitable Food Network for assistance. To date, the Valley Forge Tourism Board has collected more than $25,000 of food to feed the hungry in Montgomery County. In its 6th year, the drive continues to support the community that the Tourism Board diligently promotes to visitors across the nation and around the world. So I'd like to thank MAN for all they do to fight food insecurity and keep families in need fed. And also I would like to thank the Valley Forge Tourism and Convention Board for their commitment to helping MAN and helping these families. The Freedom from Hunger food drive will last for the entire month of September. And if you would like to donate, you can visit www.valleyforge.org/hunger. Thank you.
Thank you, Commissioner Lawrence. And I will just remind everyone that our next virtual briefing will be Wednesday, September the 9th at 3 p.m. And I'm happy to take any questions.
Thanks, Commissioner. We're joined this afternoon by Jim Melwork from KYW.
Jim, you may be muted.
You're right, I was. You mentioned that's enough out of you, Ken. You mentioned Labor Day weekend, and if I'm not mistaken, we saw spikes after the other holidays, summer holidays like Memorial Day and 4th of July. Is there an anticipated spike, and is there advice? I mean, I think you've said the advice, but what are the thoughts on from a public health standpoint heading into the weekend?
Well, unfortunately, I do expect that we will see a bit of a spike after Labor Day weekend. I hope that people have learned from our last two summer holidays that just because it's a holiday from work, it's not a holiday from the coronavirus. And in fact, if people are lax in their behavior, it just increases the chances that coronavirus will get to work overtime on Labor Day. So I really want to urge people to follow all the guidance, keep those masks on, keep that social distancing, be very, very careful at any social gatherings, and do your best to not bring this virus back to our community.
You mentioned colleges. Is there any data from colleges or is it too early? I don't even know if any in Montgomery County are back yet.
Some are starting to come back. We have not had any problems. I think we've had, an isolated case here or there, but nothing major. And all of our colleges have very solid plans, and we continue to be available to them to provide support through our Office of Public Health. And so far, so good.
And I apologize, I was distracted when you were talking about the assistance program, the rental assistance, and did you mention or did you talk about why the county has had to kind of do this and where the log jam, I guess, at the state level or federal level is?
I did not talk about that, but I would be happy to. So the Pennsylvania General Assembly did create a program of rent relief and foreclosure relief through the Pennsylvania Housing and Finance Authority. And I believe they had the best intentions in creating that program, but one of the provisions in that program has made it quite difficult to implement here in Montgomery County. In particular, there is a cap on the amount of rent that can be covered by this program of $750. And that is a pretty low rent here in Montgomery County. And the issue is that the landlord must agree to accept that $750 as payment in full for the rent for any particular month that the program is covering. So for instance, if the rent for an apartment is normally $1,200 a month, if the landlord agrees to take the $750, that they have to write off the rest. And as a consequence, we've had very, very few landlords agree to participate in this program. So the program that the county is putting together using CARES Act funding will have a higher amount that can be, again, should we pass this, we haven't voted on this yet, but should this pass, there will be a higher cap of rent that will be available. The monies are paid out directly to the landlords or directly to the utility company, depending upon which or both of those an individual household requests. So we're hoping by changing the upper limits on this a bit, that it will be a much more successful program.
And would that be on top of the $750 that's offered, or would?
So the way it will be set up is that an individual household would be prevented from what's sometimes called double dipping. So, for instance, if there was payment that had been paid to a landlord through the PHFA program as it exists, this would be separate from that, but would be on top of that. So there wouldn't be the ability to double dip.
And if I could ask you about testing, and you mentioned the 22% of county residents have been tested at some point. Is there really much value to that? Because, like, I, for example, was tested back in May, and if I'm part of that 22%, really, what's the value of knowing that I was back in May, and what can be done to kind of change that? You know, specifically rapid tests and at home tests and things. Is there a way to make that testing more of an actual surveillance rather than just a blip in time?
Well, I shared that number because I get asked that about it somewhat frequently about how many people in the county have been tested. There was a recent article in a Philadelphia publication that compared Pennsylvania to many other states. And as a whole, the state was pretty far down on that list. But as a county, we're doing better. So I just shared that mainly because people frequently ask me that number. But to your point, what's most relevant is the most recent testing. And as you've seen, and you can see it most easily by looking at our positivity graph, we continue to test more people every day, over time. Our arc is upward, which is great. I've shared with you previously that the public health experts that work on modeling believe that if you are testing enough people that you are seeing about a 3% positivity rate, once you get down to those low of numbers, that probably means you're testing about the right number of people, that you're doing enough public health surveillance, meaning that you're testing people who are negative, that you're fairly likely to pick up the positives that are there. So we've been working hard to make more testing available and to make it as accessible with at minimal barriers to as many people as possible in this county. Because the more people we test, the more we know as a county about where the virus is, where we might be having an outbreak, so we can get on top of it early and quickly before it becomes a real big problem, and do everything that we can to keep this community safe.
And addressing that specifically, the more you know, outbreaks, et cetera, are there rapid tests? Is there anything that at home tests, especially not something like the Abbott cards? I forget the exact name that has to be administered by a health professional. Are we there yet? Is there anything that at the point to actually have better, not just a diagnostic, but more of a surveillance?
I'm not aware that we've got any at-home tests that have been approved. I do know that there are companies that have them in the pipeline, but I'm not aware that anything's been approved. Hopefully we will have that one of these days. That would be very helpful.
And I think after the CDC guidance changed a little bit, there was some back and forth, the recommendations on who should or shouldn't be tested. Is there clarification from the county standpoint on I assume it's everybody?
Yeah, so I did not agree at all with that CDC recommendation, which I believe they walked back the next day. Our position has been and will continue to be that anyone who needs or wants to be tested in Montgomery County, we welcome you to any of our testing sites. That is far and away the safest public health strategy to make sure that we know how much disease is in our community, where it is, and to get on top of it quickly before we get into a full-blown outbreak like what we saw back in the spring.
I think that's it for me. Thanks.
Thanks, Jim. Now we'll go to Teresa Harris with some questions from some other reporters.
Yes, Deanna Durante from NBC10 had a couple of questions. Are you aware of Montgomery County school districts that don't have enough money for computers or technology for students to learn online? And if so, are there any resources from the county that can be loaned to districts, such as laptops and Chromebooks, to help? Is there any ongoing assistance provided by the county to help the districts during the virtual learning process?
So, about, as I've spoken about many times, I meet regularly with our 22 school superintendents. And there were a few school districts that were concerned mostly about internet access and being able to get enough hotspots for their students. And you may recall 2 weeks ago, maybe it's been 4 weeks ago now, the county approved $15 million of CARES Act funding to go to our school districts. Every one of our public school districts did receive a share of funding, and we use the federal Title I formula to distribute that funding. We use that formula because that formula specifically takes into account poverty within specific school districts. So we tried to get those dollars to where they were needed most. Since we have made that allocation, I have not been made aware of any school district that is struggling to get the equipment or meet any of those other needs.
Thank you.
Are there any other questions, Teresa?
No.
All right. Well, then, if that's it, we will see you all next Wednesday. And please have a fun but safe Labor Day weekend. Take care.